my research question is, what is the impact of COVID-19 on the mental health of learners, their parents and staff in a range of schools in Cumbria? And what do they perceive as an appropriate recovery plan? And this research is literally in embryonic stage. So one of the reasons why I volunteered to present it at this session now is to get people's ideas really as to how to go about this. So basically it came as a result of a call from Kaz Stewart to apply for some funding from UKRI, and we're going to be looking as a team of researchers from the University of Cumbria, we're going to be looking at the effect of COVID-19 on Cumbrian young people. So we're going to be doing that in various different ways, and there are various researchers from the other research centres as well. So from Lois's CNPPA one, that, you know, protected parks and national parks and protected areas, and also Kaz's Health Research Centre. One of the things that I wanted to do was I'm working with Sue Wilbraham, who's from the psychology department here at Cumbria. One of the things I wanted to do was actually look specifically at young people, probably the ages of about 14 to 18, although we might start from younger, in terms of what they feel about how the restrictions of being in lockdown and being stuck at home, how that has impacted on them in terms of their own mental health and also their trajectory in terms of their academic progress. One of the things that I looked at, and I don't know whether anybody's seen this, is Daisy Fancourt and a whole load of people from UCL have actually been collecting data on COVID-19, and they've been doing a very robust quantitative study where they've looked at, in the third week, they've been doing it each week, but in the third week they were asking participants to focus on psychological responses, and they reported the link, I'll send you the link at the end, and they reported on the fact that to start with, there was compliance with government advice, which over the 3 weeks has increased since lockdown was announced. However, compliance is lower in younger adults and highest in those over 60. Confidence in government has increased since the lockdown. They also noticed that there's been a slight increase in depression over the past 2 weeks, but a slight decrease in anxiety levels. So one of the things that we're hoping to do is we're hoping to put out a survey through Cumbria County Council to actually use the two classic measures of depression and also anxiety levels to actually think about stress and depression and compare that with these national findings that Fancourt and so on have come up with. They also noted that the levels of suicidal thoughts have been relatively stable. They've been higher among younger people, especially those living alone, those with a lower household income, and people with a diagnosed mental health condition. They said it was too early to interpret data on potential changes in self-harm and abuse levels, but graphs for the whole of the sample that they'd got so far, and it's a growing sample. It started off with about 40,000 participants. I think it's up to about 70,000 now. They're looking at how things have changed. Notably, in this third week, that's the data that I'm looking at from their study, life satisfaction has been gradually increasing in the last 2 weeks, and it's been more volatile among younger adults, those aged between 18 and 29. So that's slightly older than my study, and particularly people living alone. They said that loneliness levels have been relatively stable since lockdown, but it's been overall higher among younger adults. So basically, the particular area of study that I'm really interested in, as I said, is what the impact of COVID-19 is on the mental health of learners and their parents and staff in a range of schools in Cumbria. And what do they perceive as an appropriate recovery plan? We've got to think of a better word from recovery plan. It's basically what how do you see what do you see as your needs for getting back to normal? Now, what I want to discuss just in this lightning talk now is really some conceptual and ethical issues with our study, and also some practical issues. I mean, I'm realizing that the people that have signed on this lunchtime are probably quite experienced researchers, but there might be people who listen to these talks who might not be. So forgive me if I'm teaching grandmother to suck eggs here. So one of the things that I think we need to consider when we're designing our study is, might our survey itself disrupt the equilibrium of these young people and unintentionally bring about or cause depression and anxiety through getting these young people to think about their situation, through this self-reflection. And we're also asking teachers and parents to fill in this study as well. So that will hopefully give us a little bit of background, and that in itself might, as I say, disrupt equilibrium and unintentionally cause anxiety and depression. Because there are these other studies flying around, what we've really got to think about is, in what way is our study a niche area? What gap is it trying to fill? And so, how could our project add to the debate? Some of the practical issues, obviously, for those of you who don't know, I'm the director of the LED Research Centre, and one of the things that the LED Research Centre can do is to support the design of your study. We can help with funding opportunities, so I've just given an example of the funding body that we're applying to. When you do an internal funding procedure, you have to fill in scorecards and go through internal approvals. So that's one of the things that we're doing at the moment. We have to also go through ethical approval, and I've done that. And Diane Cox heads up the ethics panel, and so we've made sure that that's all done and dusted and thought through very carefully. We also, as an LED Research Centre, offer critical friends support. So that again is something which we're engaging in now. This is my critical friend support, where I'm hoping that you will comment on what you think so far, bearing in mind that this is in embryonic form. And then of course LED can also help when the project is done and dusted, and we've got our findings. LED can provide us with opportunities to have seminars to disseminate our findings, and conferences and so on. And we've got our 2 networks which are to do with one of our themes. So we've got assessment in higher education and TEEN, the Teacher Education Advancement Network, and some other dissemination opportunities.